Hello friends, today we are going to discuss about non-invasive diagnosis means the detecting the any disease or any discomfort to the body without any injections, surgery, any cut on the skin. How to diagnose? By asking the questions or by the waves sending to our bodies, that is ultrasonic sound to the bodies, or the blood pressure, that is the outer instrument, there is no harm on the body, so that is the non-invasive techniques. There is the x-ray, MRI are the major and the high standards equipments are used to diagnosis under the non-invasive techniques. So if there is a stomach pain and there is a bacteria attacking on the stomach, so how can we detect? There are also two techniques, invasive and non-invasive. We discuss if by asking the questions, that is the gram-negative bacteria that enters the stomach and that is the harm the stomach lining, the whole stomach lining. We can detect it by the testing the stool, which is under the non-invasive, by testing the urine, which is under the non-invasive, and by the breathing. There is a low carbon dioxide or the higher carbon dioxide amount. By detecting these are the non-invasive techniques which are under the diagnosis. And the other thing is there the invasive techniques which body needs the cuts. Endoscopy, there are the camera is insert on the inside the body, so the abdomen, the gut microflora, the intestinal lining detected which is normal or abnormal. Then how this diagnosis is happen? This is the non-invasive endoscopy. In the heart patient, in the diabetic patient, they are more prone to be the heart disease. Yes, they are the coronary artery related disease. So in this condition, the surgeons prefer to the angiography is this the body needs the cuts, but there are the ultrasonic sounds that can detect the heart muscle, the 3D heart, and there are more ways. But the ultrasonic sound and the CTs cannot detect the functioning of the heart muscle. Hence, the angiography is to be taken that the arteries and the veins, there is a lower blood supply here, and how is the functioning of the each arteries and the veins in the heart. So the diagnosis is easy, like the non-invasive. There are the minor invasive, like the detailed. Again, because there is a minor case of the invasive. Non-invasive means there is nothing help the outside, but minor invasive we have to help from the outside. Like if the person is, if there is a urine, then like if the small kids or children are prone to the wet in bed due to the urination, the uncontrolled urine on there. So there are the dysbiosis, that's a drug given to the children, but this is the non-invasive technique. But if this is not the case, actually the nerves are not working properly here, then this drug cannot treat the disease like uncontrolled urine and there is a weight in the bed. So there are the invasive technique also may take on that depend on the various patient to patient while they're treating the disease. And in the mostly the non-invasive techniques are not like working for all the women as compared to the men, that is the working in this case. So there are the minor invasive techniques have to be go to there, and which also there are the angiography also cannot work proper in the women. So means that is these techniques are used for there are the lower the proper blood supply in the arteries and veins are going or not. The calcium in the arteries and the veins, if the calcium amount is increased, then the more chances to blockage there, and the various methods are used to treat this. And the one other thing is the arteries and the veins. There are to diagnose the arteries and the veins are the good or not bad. Then the non-invasive techniques are good. These are the modern and it is not easily available, but near the heart doctor and heart patient at the big hospitals, these techniques are available, and these are the low cost and without any cut on the skin. They can detect and they can diagnose the disease, that which types and which subtypes are there. But the minor invasive also may happen there. So these are the case here. There are the adenomyosis disease, which is urinary bladder. There is an infection and which found the under the endometrium and the outer the endometrium. There are the two types of it. So outer to inner and inner to outer of the uterus. So there is a non-invasive techniques are working here well without cutting anything. Then the outer there is a non-invasive techniques are used to diagnose this. The many diseases like this can treat with the CT, can diagnose with the CT scan, MRI, the X-ray techniques. These are the non-invasive technique. There's no cut in the bodies to be happen here. So that is all about non-invasive techniques, and thank you.